Hello, these presentations will talk about the care environment, which is focused on person-centered care. Throughout our nursing studies, the term person-centered care is one that is frequently focused on. We are taught to use person-centered care with the hope to expand and develop on what is currently being implemented within today's healthcare system. Before we can learn how to implement these are practice, we must understand what is the term means and how it is applied to the healthcare. What does person-centered care mean? Research suggests that person-centered care definitions differ and are not always so straightforward. A simple explanation by Dell is that person-centered care considers an individual's priorities and needs rather than those of the healthcare system. There are numerous aspects surrounding person-centered care, including recognition of the patient's unique experiences, values, needs, and preference, and providing comfort and emotional support and building therapeutic relationships between healthcare professionals and patients. It includes the sharing of information and power through the engagement of patients and their families and designing the care plan which considers the patient need. How is this achieved? We achieve this holistic care by providing a nurturing physical and emotional environment, enabling patients to feel safe and empowered so they can collaborate with healthcare professionals in their plan of care.
Focusing on the care environment, there are 7 relevant characteristics which are appropriate skill mix, systems that facilitate shared decision making, effective staff relationships, the sharing of power, the physical environment, organisational systems that are supportive, and potential for innovation and risk taking. Exploring these 7 characteristics will give us a better understanding of what they are and why they are relevant to nursing. According to McCormack and McCance, skill mix is most often considered in a nursing context and means the ratio of registered nurses and non-registered nurses in a ward or unit nursing team. In a multidisciplinary context, it means the range of staff with the requisite knowledge and skills to provide a quality service. Within a care environment, it is important to alleviate registered nurse or RN shortages. Employing enrolled nurses or ENs is a way to allow more time for RNs to meet the needs of higher level patient care, as ENs are then able to attend to the lower level duties of the RN. However, reducing the amount of RNs and employing more ENs could lead to increased patient length of stay times and mortality, which could negate the practice of employing the cheaper ENs. Studies examine the relationship between the skill mix of registered nurses to assistants in nursing and patient-client outcomes in 2 hospitals within Australia. The study found that increases in overall nursing hours had no significant effect on patient outcomes. However, increasing the percentage of RNs on hospital wards by 10% was associated with a decrease in the rate of adverse patient outcomes. This provides a good example on why it is vital to have the right mix of qualified nursing staff to prevent complications and to promote recovery. Shared decision-making in nursing refers to organisational commitment to collaborative, inclusive and participative ways of engaging within and between teams. To achieve best practice care delivery, healthcare workers within teams must work together to optimise patient care. To achieve this, we should look at strategies to manage patients. For example, it's not unusual for healthcare workers to disagree, which can result in shared decision-making being challenged. In order to avoid such challenges, we require systems which can assist with the decision-making process. For example, it is argued that health information technology systems, such as a secure communication system, not only play an important role in delivering effective, high-quality patient-centered care, it also improves the functioning of clinical teams. Effective staff relationships are described as interpersonal connections that are productive in the achievement of holistic person-centered care. This is important because, as well as developing positive relationships with patients, we should also encourage and nurture our professional relationships. Within these, we should uphold the same values and standards as we would with our patients. If we fail to build such relationships, this could have a negative impact on the care experience for patients and their families. The sharing of power is defined as non-dominant, non-hierarchical relationships that do not exploit individuals, but instead achieve the best mutually agreed outcomes through agreed values, goals, wishes, and desires. Why is this important? McCormack and McCance argue that the issue of power sharing is closely linked with effective staff relationships, and the issue of power in teams is inevitable, so needs to be considered to ensure effective person-centered processes. It is further argued that nurses need to understand their knowledge is power and they need to challenge practices which resemble positional power being used by those in charge, which lead nurses to have little control over their practice. Historically, this occurred through religious and military orders where nurses were forced to obey those in senior positions. Since nursing has moved away from such organisational systems that invoke domination, it has now developed a greater self-esteem and confidence. The physical environment. McCormack and McCance believe that the physical healthcare environment should balance aesthetics with function by paying attention to design, dignity, privacy, sanctuary, choice or control, safety, and universal access with the intention of improving patient, family, and staff operational performance and outcomes. Why is this important? Well, the physical environment can affect patient and staff satisfaction levels, so there is a need for balanced and relevant design. McCormack and McCance argue that the introduction of single patient rooms provides privacy and dignity, increasing patient satisfaction. However, their introduction also hinders patient-centered care by limiting visibility from clinical staff. Furthermore, as well as patient satisfaction, good healthcare delivery requires satisfied and motivated staff, and the physical care environment play a key role in this. Studies conclude that staff found the highest satisfaction from a range of physical elements, including finishing materials, artwork, light, and air quality. Furniture design and thermal comfort was also highly rated by staff. Supportive organisational systems. McCormack and McCance say these are organisational systems that promote initiative, creativity, freedom and safety of persons, underpinned by a governance framework that emphasises culture, relationships, values, communication, professional autonomy and accountability. Why is this important? Well, support systems can have significant impact on teams within a wider organisational context and not just at a team level. An example of exceptional support systems include magnet hospitals, which are hospitals that have been recognised by the American Nursing Credentialing Centre for operating a system which includes transformational leadership, structural empowerment, exemplary professional practice, new knowledge, innovations and improvements, and empirical outcomes. Hospitals holding such recognition demonstrate an ability to recruit and retain high-quality nursing staff with high levels of engagement and satisfaction, demonstrating a healthy nursing culture. Potential for innovation and risk-taking. McCormack and McCance say this is the exercising of professional accountability in decision-making that reflects a balance between the best available evidence, professional judgment, local information, and patient-family preferences. Why is this important? Well, nurse leaders should encourage risk-taking as there are organisational and personal benefits which include increased patient satisfaction. Other benefits include staff self-awareness, self-empowerment, self-confidence, and job satisfaction. Organisations can also benefit from being on the cutting edge of healthcare delivery. To encourage risk-taking, nurse leaders should provide an environment where discussions are welcome and blame-free.
The care environment in nursing and the components which ensure it are linked closely with leadership skills which are vital to ensure this person-centered care is upheld. Leadership, an essential part of being an efficient nurse, allows the nurse to thrive in their work environment, inspire and engage other colleagues, and excel in giving optimal health care. It maintains a care environment which benefits both the healthcare professionals and the patients involved. However, we come across challenges in the real world of practice which we will identify in each of the components. As we looked at previously, appropriate skill mix in nursing requires a balanced level of unregistered to registered nurses. This is important for leadership as usually the registered nurses assume the leadership roles due to a wider understanding and education, which reduces avoidable incidents and the value to rescue patients. The appropriate staffing mix is difficult to secure due to ENs being cheaper to employ. Furthermore, many hospitals, faced with pressures to protect financial margins, are mandating nursing staff ratios or hourly productivity rates that ignore skill mix and total cost, leaving nurses to feel overburdened. Previously in healthcare, nurses have been expected to follow their leaders' orders. This method of learning, now outdated, has led to the implementation of shared decision-making. A true leader must be challenged to work with their co-workers in a context of mutual respect and collaboration. It calls for a need to deliver high-quality care whilst working with leaders within and from other healthcare divisions. Effective staff relationships ensure each worker is in a comfortable environment, creating efficient teamwork, which decreases patient incident. The implementation of building these relationships creates challenges for leaders like proper communication and establishing positive work environments and cultures. A leader must use effective communication by engaging, actively listening, being aware of body language, and being more concise. Leaders must also be challenged to encourage the celebration of successes and the recognition of mistakes as an opportunity to learn and grow. Leadership skills in nursing have evolved so that the modern approach in sharing of power is recognised in healthcare. We find ourselves in a competitive healthcare environment which requires a powerful team of participants with staff at all levels to provide healthcare in mutual partnership. This competition for leadership calls for a shared power approach. It challenges nurse managers to value all staff contributions, to serve as role models and mentors, and to energise and influence staff in a positive way. Managers should resist attitudes of staff ownership so people will feel like a valued member of the team. Nurses are challenged to allow other members of their nursing staff to lead in their place. The physical environment has a range of leadership challenges in the modern healthcare system. It includes the delivery and reception in which the care is given. There should be a safe and effective environment with the appropriate use of equipment to suit the patient. Leaders are encouraged to assess the patient to reduce complications and delegate the appropriate equipment to cater for their needs and safety. If the equipment is not available, for example, due to being too expensive, then this environment cannot be procured. They must also make sure that the patient has the privacy to feel comfortable. A supportive workplace will lead the nurse to feel satisfied in their job, which leads to longevity of employment and satisfaction, which leads to better safety, healthcare, and patient satisfaction. Leaders are encouraged to support each worker and value their opinion, as communication within nursing is crucial for maintaining patient safety. A negative environment creates tension between people, making unclear goals and creating a high turnover rate. The last 20 years have brought about massive changes in technology in the medical world. Current advances of technology benefit patients by providing exceptional new ways of care. Whilst they provide many benefits, there have been several challenges which have arisen, which affect healthcare leaders. For example, newly implemented programs like electronic healthcare records require implementation challenges and getting consistent use of it through each healthcare facility. Further technology like 3D printing can create layers of human tissue and the future potential to create human organs for transplant. However, the printing materials are expensive and further experimentation and research must be conducted for nurses and healthcare professionals to be able to use it effectively. Furthermore, the cost and time it would take for training others for these new technologies poses as a major issue in the leadership sectors. However, if nurses are educated properly on the use of these, they have the potential to maintain exceptional care of patients in the future.
What is nurse-led innovations? Nurse-led innovations demonstrate improved patient outcomes. It focuses on patient-centered care and how improving quality and safety through partnerships with patients and consumers will be delivered. It is creating and exploring new ideas to help better the health industry.
If we look closer at these innovations, we can find exceptional nurse-led creations. Today, we will be taking a closer look at the patient bedside tablet. This tablet computer application provides interactive information to the patient. It enables all healthcare records and history to be digitalized, providing easily accessible information for both patients and nurses, even the family of the patient. It works by hospital staff teaching patients how to use the tablets, which allows them to be able to view information about their hospital stay. This includes the medications which they are receiving, lab results, and photos of their care team. They can call for a nurse directly from the tablet, record their pain levels, and ask their care team questions. They can also access their emails, entertainment, and the internet. The tablets were implemented in the Columbia University Medical Center, which is part of the New York Presbyterian Hospital, in 2011. During the time they were used, it was found that patients who had access to them, according to Brown, had greater satisfaction of stay than those who didn't. The patient satisfaction is essential to ensuring that the care environment is ensured. They upheld the care environment by allowing patients and selected family members to access information, which ensured shared power and decision-making between those affected and the health professionals. In this decision-making process, because the patient was more involved in the process, it increased the patient's compliance with care plans. It built on holistic relationships as patients could easily connect with their care team and ask questions and express concerns. Furthermore, it broke down the communication barrier often found between patient and professional. Nurses found that time, effective convenience, and communication increased productivity and helped them collaborate with other staff members to avoid errors. This helped build supportive organisational systems and effective staff relationships.